Dear students, we can discuss about embryo transfer. Before discussing about the topic, those who are not yet subscribed my channel, please subscribe, share among your friends and give your suggestion in the comment box. Embryo refers to the early developmental stage of an animal while it is in the egg or within the uterus of the mother. In humans, the term is applied to the unborn child until the end of 7th week following conception. From the 8th week, the unborn child is called fetus. So, you know what is embryo and fetus. Early developmental stage or within the egg or inside the uterus of the mother is called embryo. But from the 8th week of conception, it is called as fetus. Embryo transfer refers to a steps in the process of assisted reproductive technology in which embryos are placed into the uterus of a female with the intent to establish a pregnancy. This technique is used in human or in animals, in which situations in the goals may vary. Next we can see what is embryo transfer technique. Around 2 or 3 days before the embryo transfer, the doctor will choose the best egg to transfer to the womb. So actually embryo transfer technique is the last stage of in vitro fertilization. We can discuss IVF in detail in next video. So justly they will stimulate the production of maximum egg in the ovary and collection of the egg will take place. Then that is taken into the laboratory for fertilization. After fertilization, when the embryo is formed, so that will be transferred into the uterus or womb of the mother. In this technique, there are different steps are there. The first one is choice of the embryos. Choice of the embryos. Around 2 or 3 days before the embryo transfer, the doctor will choose the best egg to transfer to the womb. There are many processes available in the aid of selection through non-invasive methods such as metabolomic profiling. What is metabolomic profiling? Metabolomic profiling is the process of selecting the most beneficial eggs based on a number of different factors. Next step is fertilization and culture. These eggs will be then fertilized in the laboratory and left to culture for 1 to 2 days. If many good quality embryos develop, the ones that are not to be transferred can be frozen. So next is the transfer. Embryo transfer is a 15-minute procedure accomplished by inserting a catheter, that means preloaded with embryos into the uterine cavity. The embryo transfer process is similar to the process for a pap smear. The doctor will insert a speculum into women's vagina to keep the vaginal walls open. Using ultrasound for accuracy, the doctor will then pass a catheter through the cervix and into the womb. From there, the embryos are passed through the tube and into the womb. The process is usually pain-free and rarely requires any sedatives. Embryos are generally transferred to the woman's uterus at the 2 to 8 cell stage. Embryos may be transferred anytime between day 1 through day 6 after the retrieval of the egg, although it is usually between days 2 to 4. Some clinics are now allowing the embryo to reach blastocyst stage before transferring, which occurs around day 5. Around 2 or 3 days before the embryo transfer, the doctors will choose the best eggs to transfer to the womb. There are many processes available to aid selection, though non-invasive methods such as metabolomic profiling are being tested. These eggs will then be fertilized in the laboratory and left to culture for 1 to 2 days. If many good quality embryos develop, the ones that are not going to be transferred can be frozen. Embryo transfer is a 15-minute procedure accomplished by inserting a catheter, that means preloaded with embryos, into the uterine cavity. From there, the embryos are passed through the tube and into the womb. The process is usually pain-free and rarely requires any sedatives. Then we can see what are the types of embryo transfer. See, there are three types mainly: fresh embryo transfer, frozen embryo transfer, and blastocyst embryo transfer. In fresh embryo transfer, once eggs are fertilized and they are cultured for 1 to 2 days in the laboratory. After that, the best embryos are chosen and be inserted into the uterus of the mother, or that transfers directly into the uterus of the mother. That is called fresh embryo transfer. In frozen embryo transfer, any healthy embryos that have not used in the first transfer can be frozen and stored for future use. These can be thawed and transferred to the uterus. The next is blastocyst embryo. You know what is a blastocyst? If many healthy embryos develop after the fertilization, it is common to wait to see the embryo develop into blastocyst. Blastocyst embryo transfer high success rate, but recent studies suggest that it may pose risk later in pregnancy and should be always, and it is not recommended. So these are the types of embryo transfer, which are the fresh embryo transfer, frozen embryo transfer, and blastocyst embryo transfer. Next we can see what are the conditions for embryo transfer. Embryo transfer is needed where natural fertilization is not an option or has difficulty occurring. There are many reasons for embryo transfer, including 1. Ovulation disorders, damage to fallopian tubes, third one endometriosis, then premature ovarian failure and uterine fibroids, genetic disorders and impaired sperm production. So these are the reasons for embryo transfer. Next we can see risk and precautions for embryo transfer. The risk for embryo transfer is very low. These risks are mostly related to increased hormonal stimulation, increased risk such as a blood clot blocking a blood vessel. The woman can also experience bleeding, changes in the vaginal discharge, infections and complications of anesthesia if it is used. The risk of miscarriage is about the same as in natural conception. The greatest risk of embryo transfer is the chance of multiple pregnancies. This may increase the risk of stillbirth and children born with disabilities, and is more common in pregnancies due to IVF than natural conception. Dear students, thank you for watching. See you in next class with another topic.